the Prime Minister is said to be improving as he faces a third night in intensive care being treated for coronavirus. Downing Street says he's sitting up in bed and engaging positively with staff at St Thomas's Hospital. Health experts say that the lockdown rules introduced by the Prime Minister over 2 weeks ago will be reviewed as planned next week, though there's no suggestion that they'll be relaxed anytime soon. And the World Health Organization has warned countries against lifting the restrictions at this stage. Now, the latest daily figures show that 938 people have died in hospitals in the UK. That is the highest figure reported so far in a 24-hour period. But that figure does not include deaths in the community or in care homes. And it brings the total number of deaths in the UK so far to 7,097. Well, we start this evening with the latest from Westminster and our political editor, Laura Kuensberg.
Still the wait. The Prime Minister still in intensive care. But Boris Johnson's condition in hospital is improving. He's sitting up in bed. The dilemmas for government will still come.
Good afternoon.
The Chancellor taking the lead today.
The latest from the hospital is that the Prime Minister remains in intensive care, where his condition is improving. I can also tell you that he has been sitting up in bed and engaging positively with the clinical team.
This is more than an immediate health emergency, though, for the Prime Minister and the many thousands of families around the country with loved ones at risk. Shuttered shops, closed down commerce, the outward signs of a massive hit to the nation's wallet for as long as this lockdown goes on.
Do you accept, Chancellor, that under the lockdown there is a trade-off between protecting people's health and protecting people's jobs?
Our priority is to protect people's lives, their health and well-being. That is our absolute overriding priority. We have also put in place unprecedented and significant measures to protect people's jobs. I think we will all see a significant impact on our economy. And I've also been very honest that in spite of what are unprecedented measures in scale and scope, I can't stand here and say that I can save every single job, protect every single business, or indeed every single charity.
We're not far off 3 weeks since the original stay-at-home instruction. And by law, ministers have to say by next Thursday if the rules should stay in place. But with saving lives the absolute priority, no one round here thinks the doors will suddenly be thrown open. But the longer the emptiness lasts, the more the financial hurt to the country. There are simply no easy choices ahead.
We're still getting bad figures. And so therefore, it seems to me that saying that it's likely that the lockdown would be relaxed in any way, a decision taken next week, would be premature, not least because not only might that have public health implications, it would also have economic implications.
Some of the country's leaders crystal clear already. The rules won't go next week.
I must be plain with all members. These restrictions will not end then. We will not throw away the gains we have made and the lives we can save.
With restrictions on all our lives still in force, conversations that might have seemed fanciful taking place online.
And are you holding out pictures of your mummies and daddies?
This is a picture of my mum, and she works for the NHS as an admin for the health visitors, and I'm really proud of her.
A chat between the royal couple and kids of key workers still at school in Burnley. Life continues, even though it is not normal. Hopes for patients in public life and everywhere, wanted soon at home. Laura Kuensberg, BBC News, Westminster.
Well, the government's stated aim of carrying out 100,000 tests a day by the end of this month has been described as a stretch by Sir Paul Nurse, who leads the prominent research unit, the Francis Crick Institute. The current figure being tested is about 14,000 a day. Sir Paul made his remarks in evidence to the House of Commons Science Committee. Our health editor, Hugh Pym, looks at the government's performance in trying to meet that testing target.
The planes are grounded, but there is activity at Gatwick Airport as part of the response to the coronavirus. A long-stay car park's being used as a drive-through testing centre for NHS staff. Others have been set up to allow health workers to come out of self-isolation and back to work if they test negative. The government's working with academic and business laboratories to boost testing for patients and NHS staff. But the new target of 100,000 a day by the end of this month looks ambitious.
We all have to work together to try and achieve what has to be achieved. 100,000 is a stretch, though. It is a stretch.
3 new large laboratories, including this one here at Milton Keynes, have been set up to process tests on NHS workers. And the official leading the programme told a Commons committee they would significantly boost capacity.
We're at the stage now where those labs have been through their setup phase, their testing phase, and they're starting to roll out testing. So we're about to see their capacity increase exponentially.
So what about antibody tests based on blood samples? They show whether someone's had the virus in the past and is immune. Officials said samples from overseas companies had been paid for, but they weren't reliable.
Well, we ordered the tests on the basis of the minimum volumes needed to get the samples so that we could test them. And now we'll be working with companies to cancel the orders and get our money back where possible.
Testing in the UK has gone up to just under 13,000 people a day. The government target is on the number of tests, now about 14,700 a day. People are sometimes tested twice. That's still way short of the 100,000 a day target in 3 weeks' time.
Can be missed as well.
Chintal is an occupational therapist who visits patients in their homes. She's now got the virus. She told me why testing for NHS frontline staff is so important.
It's anxious time for everyone. Everybody would love to have testing done. I myself, would have ideally liked to have had testing done, say, a few weeks ago, because it's a bit like, well, are we being exposed? Are we being carriers? Because it's the 7 to 14 days.
With more COVID-19 patients expected, a new temporary hospital at the Manchester Central Conference Centre will be ready within a week, according to local health chiefs. And next week is when the start of the peak pressure on the system is predicted.
We are standing at the foot of the mountain.
2 weeks ago, I spoke to 3 hospital doctors about their hopes and fears for the future. Since then, Rob has been off work with the virus and returned.
We don't know what the outcome of some of these patients will be.
I caught up with Katie again this morning.
This is a virus that doesn't have a specific treatment, and all we are able to do is support people's organs as best we can and hope that they recover, and significant numbers of patients are not recovering and are dying, and that is obviously a terrible tragedy for every family.
But many recover. Hilton here gets a rousing send-off from staff at Leicester Royal Infirmary after getting the all clear.
And Hugh Pym is with me, our health editor. Let's talk first of all about the official figures today, Hugh, this new high of lives lost in a 24-hour period.
Yes, Hugh, scientists may have predicted that the line charting deaths was moving in this direction. It was always going to get here. Even so, it looks shocking, doesn't it? More than 900 new deaths reported in a single day. Now, officials at the Downing Street briefing pointed to the number of new cases, new infections, and they said they were not accelerating out of control, and that was good news. And all of this is very important as officials try to judge exactly when the UK has reached the peak of this epidemic.
Yet again today, we've been talking about testing and testing capability in the UK, and the comparison being drawn yet again with Germany. What more light can be shed on that?
Yes, Chris Whitty, the Chief Medical Advisor, saying Britain had something to learn from Germany because of the number of tests carried out there. So if you look at death figures in these different countries, this chart was shown today, measured from the first day 50 deaths were reported. You'll see on the different lines in the graph that the UK is in the middle there, in line with Italy, below Spain, but above Germany in that path of deaths. And I think this is going to become ongoing, an important area for experts to look at. Officials said today it was only one part of a set of very different things. You couldn't say that the number of deaths was down to testing, but that'll continue to be a debate, I'm sure, for some time to come.
Indeed, Hugh, thanks very much again. Hugh Pym, our health editor there.